Well, for more on how COVID-19 is impacting the new school year, let's bring in Dr. Lipi Roy. She's the Medical Director of COVID Isolation and Quarantine Sites for Housing Works in New York. Welcome back to the show.
Thank you, Rachelle.
So given what we've learned over the past year and a half in the U.S. with cases of the COVID Delta variant now surging, what do you think of now being the best time to send mostly unvaccinated children back into the classroom?
Yeah, that's certainly the question on everyone's mind, to be honest. The truth is it's a dual problem, right? On one hand, we can't have children still be at home doing remote learning. We know that it's just not an ideal way to learn. At the same time, we also need to keep children and teachers and all the adults that are in school systems safe as well. And clearly, we also have data showing that in the setting of the highly infectious Delta variant of SARS-CoV-2 circulating, we're seeing actually more and more young children become infected with COVID-19, more than we have ever during the course of the pandemic. However, I am of the belief that we can get children back into schools safely, and we really do need to do that, Rachelle.
And unfortunately, we are seeing this political divide when it comes to this. So how important is it for schools to adopt and fully implement mitigation strategies in school as they sort of fight whether or not to have these mask mandates?
Rachelle, it's absolutely critical. And to highlight what a point that you just made, unfortunately, the pandemic continues to be politicized, and it's just really unfortunate, and it's really having devastating consequences. It's critical, and more importantly, it's actually doable to have children back in schools safely. But 4 clear measures must be implemented. Vaccination must be required among all eligible individuals aged 12 and above. Masks must be worn at all times by people in school, at least until community transmission reduces. We must increase ventilation and airflow in order to reduce droplet and aerosol transmission. And fourth, we need to increase testing, because testing is a proactive way of quickly identifying and isolating infected students and staff, Rachelle.
So then what kind of funding or resources are needed to really implement all those things so that the schools can stay open as safely as possible?
You need funding to support all of these things. You need funding for masking and testing and for the equipment, for ventilation. None of these are surprises, by the way, Rachelle. Public health agencies such as the CDC, recently the American Academy of Pediatrics, as well as other organizations have clearly stated what's really needed. It's a matter of local, state, and federal governments to provide that funding in order to support the local schools.
And so a lot of parents feel sort of caught in the middle here. What should you do if you are in a district where they're not mandating masks? How do you best protect your children?
Yeah, I would just say what I've said right from the very beginning of the pandemic. Follow the data, follow the science. The science is very clear on how this virus transmits, and the fact that children are getting infected, they're getting sick, they're getting hospitalized, they're passing the virus to other people. If you're a parent in a district where schools are not following evidence-based guidelines, I would contact your local legislators, lawmakers, state, city, and local school district leadership, and really cite the data, cite the recommendations that have been put forth by the CDC, by the American Academy of Pediatrics, and as well as other agencies, health agencies that are making guidelines that are rooted in data. The data is very clear. We know how to protect children and staff that are at schools, Rachelle.
Now, I want to talk about the Pfizer vaccine, which got full approval today. And we saw that New York right away is telling all teachers they need to be vaccinated, no outs. What do you think of that strategy?
Yeah, well, in New York City, where I live and work, Rachelle, as you know, they've been implementing evidence-based strategies for a long time, right from the beginning of the pandemic, and it's really showing in our numbers. They made an announcement a few weeks back that all city employees, including people like me who are contracted with the city, must have vaccinations or weekly mandatory testing. So they've been following the data, and this does not surprise me. And in fact, I agree that teachers and staff that are in schools that are eligible to get vaccinated should be vaccinated in order to protect children. We know that that's the best way to protect children, Rachelle.
And we are seeing different levels of protection at different schools. What about things like contact tracing, regular testing, other options? How is that varying availability of these options affecting the students at the end of the day?
Well, at the end of the day, if you have variability in one school and school district versus another, that really doesn't help anyone, right? Because you're still, if you're not practicing mitigation measures universally in a consistent manner, the virus doesn't care. The virus is just going to infect anyone who is vulnerable. So we know how to defend ourselves, at least for now, from this virus using pretty effective mitigation and prevention measures. Schools just need to implement it, but you need leadership at the local, state, and federal level, and at school district levels. You need leadership in order to protect society's most vulnerable, and that includes children, Rachelle.
Well, lots of good information there. Dr. Lipi Roy there, Medical Director of COVID Isolation and Quarantine Sites at Housing Works in New York.